Endodontic therapy is a dental treatment that involves the total removal of the dental pulp, the subsequent shaping, cleaning, decontamination, and the obturation or filling of the root canal system. We used to perform the endodontic therapy only by hand instrumentation, but nowadays we also have engine-driven instruments with continuous rotating and reciprocating movements. They help us to use a single file to conform the root canals in a safer and faster way. To point it off, the new thermoplastic techniques guarantee the success of our treatments, since they fill the root canals in a three-dimensional way. Once we have drilled into the pulp chamber, the first step is to locate and to determine the working length of the root canals. We need small gauge files, for example, K files of number 10 or 15, an apex locator, tweezers to set the rubber stop at a reference point, and a little ruler to determine the length. When the canals are located, we can introduce the files. And helped by an apex locator, we should determine the exact canal length. We are going to set a rubber stop at a reference point, for example, at the cusp of each canal. We need to establish, with the help of a ruler, the exact length of each one. For the instrumentation, we would need a master file. In this case, we are using the reciproc system, these ones. Then we would need a K file number 10 as a patency file and a K file number 20 to know which reciproc master file we are going to use. We are also going to need a ruler to determine the working length and a power unit with reciprocating motion. Finally, we should use root canal irrigants and syringes with lateral aperture needles. When the master file is determined, we introduce the irrigation solution into the canal to lubricate the canal while we are using the file. We take our file and we set the rubber stop at the working length already established. We introduce the file inside the canal, doing 3 pecking movements towards apical. We clean the file with a gauze. We irrigate again. And we proceed to repeat the 3 movements till the working length. The apical calibration determines the diameter size of the root canal at that level. To establish it, we introduce a file of the same gauge as the master file, but with smaller taper, and we introduce it onto the apex with mild pressure. If we notice that the file goes through the apical foramen, we need a bigger file. In this case, we are working with a 30 gauge file, and we should do the same with bigger files till finding the one that does not go through the apex. Once the instrumentation and the apical calibration are finished, we proceed with the final irrigation. We use root canal irrigants, which are introduced into the canal: sodium hypochlorite, citric acid, and alcohol. We irrigate the canal root an established period of time, changing the syringe according to the irrigation solution. And finally, we irrigate with alcohol. After the final irrigation, we proceed to dry the canal with absorbent paper points at the same caliber and length as the file.
Las introduciremos dentro del conducto.
We introduce them to check if the canal is dry. If not, we should repeat the procedure until it is completely dry. To fill each of the root canals, we need, first of all, files to gauge the canal. They are going to be files of less taper, but similar caliber as the master file. We also need a gutter condenser, absorbent paper points to dry the canal, sealer, a spatula and a paper pad to mix the sealer, a ruler to determine the length of the canal, a calibrating ruler for the gutter percher points, tweezers to take the gutter percher points to the canal, gutter percher pluggers, and finally a contra angle to use with the gutter condenser. Once we have dried the canal, we continue with the filling with a master gutter percher point Reciproc R25 as our master file. We measure our apical caliber. In this case it's 35, and we introduce the gutter percher cone. We should cut the excess to place it into our canal length.
Y lo colocaremos a nuestra longitud de trabajo.
We mix the sealer,
cemento a partes iguales.
and dip the gutter percher point with sealer to introduce it into the canal. We place it. Before introducing the gutter condenser, we are going to check that the rotation direction goes forwards. We introduce it doing apical pressure to help the gutter percher compaction.
Para que se compacte la gutta percha.
Once the filling is made, we compact the gutter percher apically.
Hacia apical.